Hello friends, good morning and greetings to everyone. My name is Pawan Sharma and I'm a pediatrician. We have taken a small initiative of sharing our own learning with all of you through our YouTube channel Pediatric Basics. The first one, we start with the case of the month. So friends, let us start with the first picture of the month. So I'll bring up a picture in front of you. Have a think about what's the most likely diagnosis and what are the likely differential diagnosis, and then we'll talk through it. So this picture is of a lovely 6-year-old girl, and it was actually shared by one of our friends asking about, oh, what is the problem? She has been having since last 2 weeks. As you can see that there was significant redness, there was a bit of swelling, and it was quite itchy. She was very uncomfortable, although not complaining of pain. They tried some paracetamol without much help, and they were putting some emollient creams. That was also not helping. So what do you think? What's your diagnosis? And possibly differential diagnosis. I think, if I'm honest, I had no clue what was the diagnosis for this little girl. So I shared this with one of my friend who is a dermatologist, and he was straight away in replying with the possibility. So let's have a look. If we carefully look at the lesions of the toes, then it does appear that it is possibly one of the inflammatory or infective and possibility vascularity condition which could give rise to the similar kind of symptom. So for my surprise, actually this was a chilblain, and despite being in pediatrics, I have not seen in long time. It is supposed to be one of the common non-freezing condition which affects your finger, toes. Sometimes it can affect your ears, nose, and even buttocks. And it usually present with swelling, redness, burning sensation, itching, and sometimes they can have a pain as well. It is reported to be even the first or the beginning symptoms of conditions like anorexia nervosa and other autoimmune conditions. The pathology is typically described as angiitis, and that is the vessels are surrounded by the perivascular infiltrates of the inflammatory cells. Girls are especially at more risk, specifically if there is a history of Raynaud's phenomena, and then apart from that, the extremes of age, especially the old age, puberty, anorexia, and other inflammatory and autoimmune conditions are risk factors for this condition. So how do you manage Pernio or Chilblains? Number one is prevention. I think avoiding direct contact with the heat, and never go barefoot, and obviously prevention from cold is also important. Now, specific treatment is using dry, loose clothing, and there are reports that various medications can be used, and some of them have been found to be symptomatically effective are prazosin, calcium channel blocker, phenoxybenzamine have been said to be useful. First of all, thank you so much for watching this video until the end. I think the most important thing is your feedback. What do you think of our initiative as a case of the month? And hopefully we'll probably bring you more and more. So your feedback, your subscription, and your likes and comments, especially even if they are negative, are really important. So please do not hesitate to share your views, and also get in touch if you have any specific queries. Thank you so much.